So, dear friends, we'll start with our session. Yesterday, we have discussed regarding the another aspect of treatment of local maladies, and what Dr. Samuel Hahnemann have explained that whatever may be the local malady caused due to the internal cause should be treated internally. The nature sets it on external most aspect, whether it is caused because of psoric miasm, whether it is caused because of psychotic miasm, or whether it is caused because of the syphilitic miasm. It always throws the uh, expressions on the external most aspect in order to save the internal economy. So internal economy never gets affected because the disease is thrown on the external most aspect. It doesn't mean in order to cure the nature throws it away. It means that nature throws it away in order to save the internal organs, in order to save getting it more disturbed. And that's why the nature tries to throw the disease on the most uh, low organ, or where there is no directly a question of death or occurs over there, the less vital organs like skin. So in the SORA, the primary symptoms is itch. In case of psychosis, it is a pigwarts or gonorrhea. In case of syphilis, it is the primary chancre on genital. So every expression is always there on the external most aspect, and that is only in order to prevent the disorder, internal disorder. So it its vital force is not able to bring it itself to the cure, and it requires your aid. Unless and until you treat it with proper anti-miasmatic remedy, it is not possible to get an ideal cure over there. And that's what he has explained over there in detail regarding that. And even he has given in footnote that old school practitioners, they used to use the use of issues, but that also is not the curative measure. It, in fact, it used to produce more discharge of the white fluids, causing more damage to the human. And that's what we have discussed in yesterday's session. Now he is concluding the treatment of local diseases as well as miasmatic diseases. So he wants to explain few remaining things regarding it, and that's why he explains one more aspect of it in aphorism number 202. So let us go ahead with the aphorism 202. If the old school physician should not destroy the local symptom by the topical application of external remedies, under the belief that he thereby cures the whole disease, nature makes up for its loss by rousing the internal malady and the other symptoms that previously existed in the latent state side by side with the local affection. That is to say, she increases the internal disease. What he is explaining? He is explaining that how disease transfers from the less important organ to more important organ if you treat it on the surface. And this is truth. I have observed this n number of times in my last 32 years of practice. I will share many examples of it.
ಒಮ್ಮೆಲ್ಲ ಸೆಟ್ಟಿಂಗು
Now let us see whether are you getting my voice or not. Is it clear?
It's clear, sir, now.
It's clear. Okay. Okay. So I have seen many examples of it. When I have started my early practice, very early in 1991, when I used to sit along with my father and I used to learn from him. At that time, there was one patient who used to come to him for diabetes, insulin dependent diabetes. He used to come to him daily in the morning and evening to take the insulin doses. So he has developed some eczematous patch on his lower extremity. He was already a patient of hypertension, diabetes, and he used to take insulin regularly. And he was maintaining at the age of 72, 73, he was maintaining that. And he was little bit good with the help of that. But he started developing an eczema on the lower extremity. And it was very itchy. So he asked me what to do. I said, let it appear, don't do anything. He says it's troublesome. I asked him just to apply the coconut oil, don't take anything. But he was not ready to do, or he was not ready to mm, apply or to treat that. He was ready to treat that. In fact, he was not ready in listening to me. He went to skin specialist. There was only one skin specialist used to come to Sangamner at that time. He went to him. He saw this. He has prescribed local steroid ointments, clobetasol on that, and he started applying that clobetasol. Next day morning, he was there to take the insulin, and he was very happy. Yes, I have applied such and such ointment, and today, absolutely, there is no itching, and it is reduced within a day after that ointment. He was so happy. I said, it's not like that. The disease, it will trouble you. He was, how can it be? I said, it's okay. You have taken the treatment from skill specialist, let it be. And on the same day, in the evening, he got a myocardial infarction attack. See how much effect the local steroids produces. The disease has shifted its axis directly from the skin toward very vital organ, and same day he suffered from the myocardial infarction attack. These such types of effects I have seen many times. So whenever you tries to apply local ointments, it used to turn inside and used to produce a damage. One patient was brought to me. She was married, 20, 23 years age, just 1 year back married. One day she was referred by a physician that first time she had an epilepsy 15 days back, 4 days back. And she was sent first for neurological examination with the neurologist. He advised that she has her EEG is abnormal and she should take the treatment for 3 years. And that physician, she was quite good. She said, first, let us go for homeopathy instead of taking those medicines, because since childhood till today, you don't have any problem. And first time you have got the epilepsy, and why to take anticonvulsants? She was brought to me. And when I took her case, I asked just one question, whether you had any skin illusions earlier. Any skin problem? And she said, yes, doctor, 15 days back, I had a fungal infection in groin and I have applied one ointment. And it was a combination of the antifungal with steroids. And she has applied that clotrimazole with the steroids. Some steroid was there, beclomethasone or something. And thereafter, she developed such a problem. So I asked her that I will going to treat you, but after prescribing your remedy, your convulsions will stop. There will be no further convulsion, but your problem will recur. And if it recurs, don't apply that ointment and let it appear. And she agreed. I have given her medicine, maybe cuprum or ginkgo. I could not recollect at that time, at present, but she, after giving the medicine, within 8 days, she came with the same symptoms of itching in the groin with similar types of eruption. And then she never had a second attack of epilepsy since last 10 years. So this is so truth explained by Hahnemann that this is axis is getting shifted. It turns from periphery to the inside, and when it turns toward the inside, it is more harmful for the human being. So same he is explaining over there that when this if the old physician should now destroy the local symptoms by topical application of external remedies under the belief that he may thereby cure soul disease, nature makes up for its loss by rousing the internal malady and two other symptoms that previously existed in latent state side by side with the local affection. That is to say that she increased the internal disease. When this occurs, it is usual to say, though incorrectly, that local affection has been driven back into the system or upon the nerve by external remedies. And this is the truth. The local affection turns inside. Local affections damages the internal organs if you treat them locally. And this is quite a common. Previously, at least during Hahnemannian time, there were no potent medicines like present steroid medicines. There are very potent steroids now available in the market. If you apply that once, it disappears, the lesion disappears. Person is very happy, but he doesn't know that what he is doing. He's shifting his axis of disease from less important organ to more important organ, affecting the internal health, causing the damage over there. And this is what generally happens whenever you try to suppress the eruptions or any skin lesion, whether it is caused by psora, psychosis, or syphilis. It turns inside and damages the internal organs. So the exact truth which he is explaining over there, and further he explains about what should be done for this. Just a minute. Aphorism 203. Every external treatment of such local symptoms, the object of which is to remove them from the surface of the body, whilst the internal miasmatic disease is left uncured, as, for instance, driving of the skin, the psoric eruptions by all sorts of ointments, burning away the chancre by caustics, destroying the condylomatous on their seat by knife, the ligature on the or the actual cautery. This pernicious external mode of treatment, here too, so universally practiced, has been most prolific source of all innumerable named or unnamed chronic maladies, under which mankind groans. It is one of the most criminal procedures the medical world can guilty of, and yet it has here hitherto been the one generally adopted and taught from the professional chairs as only the one. And this is what the practice of old school. Whatever comes on the surface should be treated with local ethics, local treatment. Whether it is psoric, whether it is psychotic, whether it is syphilitic, they used to do same line of treatment. Everything which appears on surface is treated with local ointments. And that problem is always there with the allopathic system. And that's what he wants to explain. That when you are treating such types of disorders, it should not be treated there. If you treat there, if you remove the syphilitic ulcer by mercurial preparation, it enters inside. If you treat psychotic growths, pigworts with the knife or with the cautery, they turns inside, causing damage to the internal organs. If you remove the vesicles, the primary itch on the surface by some local application, it again turns inside. And when it turns inside, it is very harmful for the life of that human being. If it is related with the venereal diseases, it is more dangerous than the psoriatic diseases and always reflects to the health of that human being. So this is what it generally happens to be there during Hahnemannian time, and today also. In fact, today it is more strongly the local treatment is applied for. If you just sit with one day with skin specialist and see what he used to do, he used to prescribe only local steroids, local ointments, and local applications along with potent steroid, internal steroids also. Nowadays, they say that we avoided giving internal steroids. We used to give only local steroids, which never damages the health. But they don't know that they are damaging the health because the disease was transmitting from less important organ to the more important organ because of it. And this is what he wants to explain about it. So, see, The homeopathic management of all those things is definitely related with the internal treatment and not on the external local treatment. There is one footnote which is explained to this paragraph, a very small footnote which is mentioned. We'll just see what footnote is. For any medicine that might at the same time be given internally served but to aggravate the malady, as these remedies possess no specific power of curing the whole disease, but assailed म्हणजे हल्ला करणे, एखाद्या गोष्टीवर हल्ला करणे, to assailed, but assailed the organism, weakened it, and inflicted on it, in addition, other chronic medicinal diseases. See what he wants to explain over there. This is what the treatment is present in allopathic system. They used to prescribe the medicine. They used to prescribe local medicines, local management for an eczema, for psoriasis, for the lichen planus, for any skin lesion. What do? They apply the local treatment. With the help of that local treatment, the eruption disappears. Patient is also happy, and the prescribing physician or the skin specialist, dermatologist is also happy. They don't know what will going to happen. And within few days, within few months, patient suffers from some chronic malady. Patient suffers from diabetes. Patient might suffer from the blood pressure. Patient might suffer from some migrainal problems. Patient might suffer from the epileptic attacks, some cysts inside, depending upon what they have suppressed. But this is the treatment which is given in allopathy for local diseases. Hahnemann explains such a treatment is not only harmful locally, but it is harmful internally, causing more damage to the human health, causing more and more dangerous internal disorders. So he wants to explain if you have such types of disorders, one should treat it with the help of internal homeopathic management, with the help of proper miasmatic diagnosis. And lastly, we'll finish the 204. For tomorrow's session, we'll keep 205 because there is a quick footnote. In fact, two footnotes are there. We'll go for that tomorrow. We'll finish 204 in today's session. If we deduct all chronic affections, elements, and diseases that depend on a persistent unhealthy mode of living, and also those innumerable medicinal maladies caused by the irrational, persistent, harassing, and pernicious treatment of diseases often only of trivial character by the physicians of old school. Most, the remainder of chronic diseases result from development of these three chronic maladies: internal syphilis, internal psychosis, but chiefly and infinitely greater proportion internal sore. Each of these infections was already in possession of the whole organism and had penetrated it in all directions before appearance of primary vicarious local symptoms of each of them. In the case of Sora, the scabious eruption; in syphilis, the chancre or vivo; in psychosis, condylomata, that prevented their outburst. And these chronic miasmatic diseases, if deprived of their local symptoms, are inevitably destined by the mighty nature sooner or later to become developed and to burst forth and thereby propagate all the nameless misery, the incredible number of chronic diseases which have plagued, plagued means satavani, which have plagued mankind for hundreds of and thousands of years, none of which would be so frequently have come into existence had the physician striven means zagadni, had physicians striven in the rational manner to cure radically and to extinguish the organism, these three miasms, without employing local remedies for their corresponding external symptoms, relying solely upon the proper internal homeopathic remedies for each. See note 2, aphorism 282. So he is explaining over there exactly the nature of presentation of all three miasms. The sora, it is the scabious eruptions like vesicular eruption appearing on the skin surface. Second, the psychosis, a venereal disease caused because of suppression of gonorrhea or figworts. Again, expression on the skin surface or mucus through the mucous membrane per urethra. And third, the syphilis, again a single painless hard ulcer either on male or female genitalia, again a skin surface. Or buvo. Buvo is nothing but the uh, inflammation or the pustular affections of the lymph nodes. It is a pus formation, especially happens in the syphilitic disease, inguinal lymphadenopathy. It's called as a buvo stage. So such a thing, if you try to suppress it by any means, it disappears immediately. Sora disappears locally with their primary symptoms. It enters somewhere else, producing more and more functional manifestations, chronic diseases which never getting cured. Patient may develop migraine. Patient may develop neuralgias. So sensational and functional affections of the nervous system are typically manifested by suppression of the itch, suppression of the sora, primary symptoms of sora. When you suppress the psychosis, that means if you suppress the gonorrhea or pigworts by local means, it enters generally in the nervous system, producing edematous or infiltration over there. Generally, it involves the pelvic organs, gonads, producing effusion over there. Formation of cyst is there. Pelvic inflammatory disease is quite common. The pleural effusion, pericardial effusion, rheumatoid arthritis, where the effusion is more marked. That is typically of psychotic in nature. And when syphilis, primary syphilis is suppressed, it enters inside the system, affecting the destruction of the brain, destruction of the lung tissues, destruction of the bones. These are the primary sites of affections. So disease transmits from very less important organ to a very, very vital organ. And this destruction is very difficult to recover. When patient comes to you in secondary stage of either a SORA, either a psychosis, either a syphilis, it is rather difficult to cure. And for that purpose, Hahnemann says, if you want to treat such types of diseases with homeopathy, it requires only and only internal anti-miasmatic remedy. You have to find it out a right simile, depending upon the miasm of that person. If it is soric, you have to find it out a anti-soric remedy. If it is psychotic, you have to find it out antipsychotic remedy. If it is syphilitic, accordingly antisyphilitic. But a right remedy, right simile is very much necessary, and that should be only internally, so that the original manifestation, the primary manifestation, may recur on the surface again. The internal disease gets cured, and patient will get cured. So this is the way, this is the only way with which you can approach in treating such types of local diseases. There is no other way which he tried to explain over there. Only one point which he wants to explain, that only one indication where you can utilize local treatment, that he has mentioned in next aphorism, but that we're going to learn in tomorrow's session, because there he has mentioned a footnote, big footnote, in order to explain what he wants to say. So primary manifestations of all three miasms should be treated internally and not externally. This is the thing which he tried to highlight it up till now. But he changes his thought in this sixth edition of Organ of Medicine while explaining the next aphorism. But we'll keep that as it is for tomorrow's session. Till that period, if you have any query, we can discuss, or otherwise we'll conclude today's session. Any question, any query? So I think that everyone's queries are solved. It's a good thing. So We'll meet tomorrow at the same time. With we'll conclude the homeopathic management of one-sided diseases in tomorrow's session. So thank you being there, everyone. Thank you, Varkesar and Madhu, Palak, Anuja, everyone. Thanks a lot.